Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Study and play come together on a Windows 11 PC. And for a limited time, college students get the best of both worlds. Get the Unreal College Deal. Everything you need to study and play with select Windows 11 PCs. Eligible students get a year of Microsoft 365 Premium and a year of Xbox Game Pass Ultimate with a custom color Xbox wireless controller. Learn more at windows.com/student offer. While supplies last. Ends June 30th. Terms at aka.ms/collegepc.
Hey everyone, I'm here with my friend Dr. Raj with today's 5-minute care tip. And today we're talking about pulmonary hypertension management. And so Dr. Raj, what can you share with us about that?
Well, let's just take a step back and define pulmonary hypertension. So pulmonary means the lungs, and yes, there are blood vessels in your lungs, and we're going to be focusing about a major blood vessel called the pulmonary artery. And this is going to be the vessel that leaves the right atrium, specifically the right ventricle, and it goes into the lungs itself. So blood goes right atrium, right ventricle, into the lungs itself. That's the pulmonary artery. So it's called pulmonary hypertension, and hypertension means high blood pressure. So high blood pressures in those pulmonary arteries. And, we could get really into the weeds of how we subdivide it, but it's important to realize that there are certain subtypes. And if you have this disorder that, many lung doctors, and I'm going to assume you're going to see a lung doctor, may say you have what's called type 1, 2, 3, 4, or 5. Type 1 is actually very familial. And these are individuals that have high blood pressures in the pulmonary arteries at such a young age. And it also can be associated with people who have some rheumatological diseases like a scleroderma. And there's very niche medicines for that. Type 2 is because you have left-sided heart disease. So many individuals, unfortunately, have heart failure, and the pressure in blood backs up and will give you high blood pressures in the pulmonary arteries. Type 2. Type 3 means your oxygen levels tend to be low in the body. So people who have a COPD, people who have obstructive sleep apnea are predisposed to a type 3. Type 4 is on the rare side. It's people who have a pulmonary embolism, a clot in the lung, that some individuals, unfortunately, will develop chronic high blood pressures in the pulmonary arteries. And type 5 is kind of like, I don't know. It's almost like that default. But it's very important how would it present? It doesn't have any unique findings, but it presents very similar to heart failure. You could have shortness of breath when you're trying to do normal tasks. And how do we screen for it or check for it or look for it? It's getting that echocardiogram. So when you look at the heart, there are certain characteristics that they're going to look at to say, I think the pressure in the pulmonary artery seems to be elevated. And if you want to have the gold standard, talk to your doctor. They may have to do what's called a heart cath, a right-sided heart cath, to confirm the diagnosis. But the good news is that you always treat the underlying cause. That's the most important. And even if you have something like that type 1, the one associated with rheumatological diseases, or the one that's familial or genetic, that there are also good medications there. There are many centers of excellence. I wouldn't be intimidated. Your job as a caregiver is what? Just get that echocardiogram. If you're having shortness of breath, anything cardiac, get that echocardiogram and start there.
Yeah, that's a great tip. And it speaks to my situation with my mom, who this coming Monday will have an echocardiogram. Yes, to check her PAP, her pulmonary artery pressure.
Yes.
So, see, I even know the lingo here and there. So, Dr. Raj, thanks so much as always. That was great information for our audience, and we'll see you next time.
All right, bye-bye.